Hi, this is Tony Feijoo, and welcome to the Health Insurance and Healthcare Made Easy channel. Something that I want to share with you guys today that is relevant and important. You might have seen it in the news. Aetna CVS is exiting the Affordable Care Act market, what is known colloquially as Obamacare. This has happened before with other carriers in the past 11 years and has been part of the frustration and the uncertainty that we all feel in the insurance market. And I want to talk to you guys first. If you are a policyholder of Aetna, what to do, what not to do, and then let's talk about in general why are these things happening, and why we all have to address this together, particularly if you are a recipient of a subsidy or you have a marketplace insurance. So, for those of you who have a policy with Aetna, everybody take a deep breath. All good. You are covered through the ending of the year. So the company is not going under. Aetna's a very big corporation. They do a very good job on employer benefits and on Medicare Advantage. There is nothing that's going to happen with your coverage. If you have a procedure planned, if you are treating a chronic or critical condition, you have nothing to worry about. Your policy is solid and it's going to be good throughout the ending of the year. That being said, if you are having what's called a life change, I'm moving, I'm having a baby, I'm getting divorced, there's many conditions that will trigger what's called a special enrollment period. If you have an agent, and I hope you do, call your health insurance agent and state what the life change is. And then at that time, you might want to consider going with another insurance company for a number of reasons that I'm going to get into later as to what is going to happen. So the most important thing, till it's all good. The company is not going under. You got health insurance throughout the whole year. Now, what I want you to do is I want you to call your insurance agent. If you don't have one, there's many sources to find a health insurance agent. Um, you can look it up on Google, health insurance agents where I live, and start exploring what your possible options might be for next year. We still have roughly 6 months before the open enrollment on November 1st. And this is going to be a quirky open enrollment. There's a lot of regulations that are coming down the pike that on another podcast, I will talk about that because it has an impact on your ability to renew your health plan, what your premiums will be. So we need to talk a little bit about that. But start looking at your options so that by the time open enrollment comes, you can pull the trigger immediately. And I'm going to tell you why that is so important, that you make an active selection during the 6 weeks, which begin on November 1st, all the way through the 15th of December. So start looking into your options now. Here's another idea that I would recommend. Call your doctor. If you have a doctor, call him or her and say, hey, this plan is going away next year. What other product do you take? Then they might tell you, we take Oscar, we take Ambetter, we take United Healthcare. And if that doctor is important to you, then your homework is made easy. Because now you know that in order to keep that doctor, you need to make sure that you enroll in that specific plan that the doctor is taking. If there's a multiple of plans, and I hope there are, on your specific provider, then you can get an agent to guide you with the benefits, the network, the medications, and I'm going to have a podcast really talking about what is the best uh, thought process on picking a plan. But again, being succinct is make a choice by November 1st so that you are in the plan that you want come to the 1st of January. So let me tell you what the option is, and you don't want that. So depending on what state you live, right? Your state has a Department of Insurance that are great, by the way. The Departments of Insurance protect the consumer. That's their job, right? Same way that CMS, protects the consumer. These are state or federal agencies that all they do is make sure the right thing is being done by the consumer. That is why they're so important in our healthcare journeys. So in that role, if you haven't made an active choice throughout the open enrollment, they will automatically place you on a plan in your area with a similar pricing structure, a similar benefit structure, uh, because in their mission to protect you, and if for whatever reason you haven't made a selection of a plan during the open enrollment, and if you are in a continued care process with a condition, they want to make sure that come the first of the year that you have health insurance, which is a good thing, right? It's a very good thing. You've got, they're watching out for the continuity of care. What doesn't work for me there is that what if they put you in a plan that doesn't work for you? For a number of reasons. Maybe your medications are not covered correctly. Maybe the hospital that you want is not in the network. Maybe your specialist is not in the network. Maybe your doctor's not in the network. Maybe the nearest doctor is an hour away. There's a million reasons why that might not work, and it might not be the best choice for you. So come November 1st, you must do an active enrollment and know which plan you're going to. So by January, you're not caught off guard and then be stuck in a situation where might not be able to switch plans because you're going to make that harder to do after the open enrollment. So um, the industry is strong. The ACA is 11 years old. I remember being at a conference when somebody told me from a government agency, there's nothing affordable about the Affordable Care Act, and I found it extremely funny and so right on point, because there's many things about the Affordable Care Act that we need to continue to improve upon, but ultimately, it's been a great tool or vehicle to ensure a lot of folks in our country that were uninsurable before for a number of reasons. Downside is that many of us can't afford health insurance now. That's a whole other conversation that we can have regarding the economics of health insurance and why we need to figure out a way to make it more accessible to all financially. But again, the Aetna press release came this morning. They're out of the market. Everybody chill. The ones that have read it, or you will read it in the next few days, don't call Aetna. Don't cancel your policy. Don't do any of that. You're going to be insured through the ending of the year. Make an active selection come November. Call your doctor, ask them what products they take. Call your specialist if you have one. Check the drug formularies. That's a big old word for how the medications are covered by each of the individual health insurance companies. Are they a tier one medication, which means those usually have no copays? Are they a tier two? All those fun and interesting things that your agent should be talking to you about. Anyway, I thank you for being here with me today. If you want to post something on the channel, please do. I will try to get back to you as quickly as I can. Please don't forget, subscribe to the channel and enable notifications because I'll be posting a lot of super cool things here about healthcare and insurance. I am a super nerd that I think you're going to